All right, welcome back, everyone. Before we jump into our next session, we're going to share a brief message from Senator Cornyn.
Hi, I'm Texas Senator John Cornyn. Thank you for giving me the opportunity to say a few words. Our ability to innovate, think critically, and remain resilient has made our nation the global superpower it is today. From telecommunications to space travel to the digital revolution, American minds have always been our greatest driver of progress. As the economy shifts, it's more important than ever to invest in strengthening brain health and capital. Thanks to all of you for using the power of neuroscience and technology to help meet the needs of our future workforce. Keep up the good work and enjoy the rest of your summit.
All right, brain capital isn't built in isolation. It emerges from systems: education, healthcare, workforce, technology, urban design. Policy influences how these systems operate, who they serve, and how equitably they function. Without policy alignment, innovation can be siloed or short-lived. Government policy directs public funding and incentives. When policies prioritize brain health and brain capital through research grants, tax incentives, infrastructure investment, or education standards, they catalyze markets and attract private capital to follow. When governments make brain capital a strategic priority, like they have with climate or energy, it sends a clear message: this matters. It draws coordination across sectors and countries and accelerates innovation that benefits everyone. Our upcoming session will delve into precisely that, shaping the future of brain health policy in Texas and across the United States. We are privileged to have a distinguished panel of experts in policy and the private sector guiding this vital conversation. Now, please welcome to the stage, first, our moderator, Nathan Cook, Senior Director of Government Relations at Rice University. Next, Dr. Andy Keller, President and CEO, Meadows Mental Health Policy Institute. David Lebron, President and CEO of Texas 2036. Russ Paulson, COO for Us Against Alzheimer's. And finally, Joel Resendez, Director of State Government Relations at Rice University.
Great. Well, thanks everybody for joining us. And just quick housekeeping for the folks here and for those still grabbing their lunches. Note the QR code. This is going to be an active conversation. We are going to leave time at the end for Q&A. There's also an opportunity to give some feedback along the way if you avail yourself of that QR code. It could be questions, it could be thoughts on what our panelists are saying today, or it could just be random stuff, like perhaps you think the moderator of this panel is devastatingly handsome. Just putting that out there, maybe. All right, we'll see it. But there's more laughter than anticipated. Try not to be hurt by that. But launching right into it, I like to start with an icebreaker on our panels. And what stands out to me is this idea of brain health and brain skills. It seems like this is relatively timely. I have my own ideas on that about why at this moment in time. But what I'd like to open up with an initial icebreaking round from our panelists to talk about the why. So it's really a two-part question. Hopefully this is kind of an open question for you guys. First part is, what's happening now you think that makes this so timely? And the second part of the question would be maybe a personal anecdote that you could share, something you've seen or experienced or heard. David, I'd like to start with you as former president of Rice University, very near and dear to our hearts. And of course, my job remains to always make you look good. David, would love to start with your thoughts.
So I joined Texas 2036 just about a year ago, and it's a little hard to describe. I'll give you the short form description. We're a nonprofit, nonpartisan, non-ideological organization that seeks to identify and implement the database policies that will improve the lives and opportunities of all Texans. What sets us apart a little bit is the identify and implement. We love think tanks and policy institutes and similar organizations, but what we really focus on is making sure the policies that will improve the lives and opportunities of all Texans get implemented. And so we work extremely closely with the legislature, the governor, and others to make sure those policies move forward. I think the question that you pose on what's changed, so as an academic, of course, when you say what's changed, I don't look back over the last year and a half. I wanted to look back over 5 millennia. So settle in. I'm wearing my ancient Egypt socks, for those of you who are wondering. But actually, I'm going to go back more recently, because I think in some ways the biggest thing that has changed is really the destigmatization of mental health. And that comes from a number of factors. But I think very important among them is really the increasing science that we have. And it's science very broad. It's science in counseling, it's science in leadership, it's science really understanding much more about what makes us more effective as human beings. And it wasn't even until relatively recently in that long 5,000-year history that the brain was identified basically as the center of what it means to be a human being. And of course, during most of this period, people with mental health problems were distanced and put out of sight and described as being possessed by the devil. And really, even in this country, it wasn't in many ways until the 1960s moving forward, we began a process of destigmatization and really understanding increasingly the breadth of the issues that we faced. And I think other things that have happened is a real understanding of one, how broad the, not to describe it all as I say, mental health diagnosis, but we all have sort of cognitive abilities and things that we could realize to greater potential if we had that chance. And so we have this coming together of destigmatization, the advances, incredible advances in science, neuroscience, neurology. With that, I think an increasing recognition of what are the economic impacts of this, right? In terms of everything from terrible outcomes like suicides, for example, to just productivity in the workforce. And so all these forces, I think, are coming together, and what we're really seeing is incredible possibility. Possibility to treat those who are diagnosed as ill, but also possibility of moving forward. And so I think what we do, we don't focus so much at Texas 2036 specifically on mental health, because we rely on the incredible Meadows Mental Health and Policy Foundation, or Institute rather, and together here in Houston with the Hackett Center Institute. These are incredible resources, and that's maybe the last thing I'll mention in terms of what changed, is there are reasons to be pessimistic here in Texas. We rank last, dead last, in terms of the percentage of the population that is uninsured. It is greater than Texas and twice the national average. And this is important because there's a real interaction between general health coverage and mental health coverage in lots of different ways, right? Folks with mental health challenges are not seeking out the support that they need, and when they resort to things that make actually things worse, like drugs and alcohol, for example. So what we at Texas 2036 have focused on is healthcare access. 15 we worked on and failed to some extent, I guess, with the expansion of Medicaid. Texas is one of a relatively small number of states who've chosen not to expand Medicaid. But then we did a study on who are the uninsured, and it turns out only 15% of the uninsured would be helped by the expansion of Medicaid. So that leaves all of those other opportunities to work on, and that's what we're working on this session. And then we also have to focus on parity going forward. So I probably exhausted my time now. I'll turn. I don't have a great anecdote to tell, but let me just make an observation that also relates a little bit back to my academic background. I actually think one of the most important things happening here today is the rise of artificial intelligence, and in several different ways. It's going to force us to think in different ways about how we think about human cognition, as we have this kind of partner out there and we see what its capabilities are. But the second way that it's going to be important, and why I think this effort really is incredibly important for our society, is we're going to have to think differently about what we as human beings have to contribute. And how do we sustain and enhance our creativity in a world in which artificial intelligence is pervasive everywhere? Universities are going to have to rethink how we teach our students. We cannot engage in a philosophy of denial and just say, don't use AI at all. That is not a viable strategy going forward. So I think that's a piece of what's going on, maybe not so close to the core mental issues, but I think will be a part about how we think about human brain function and health going forward.
Yeah. Andy, I'll turn to you next.
Well, thanks. And I'm going to start with the anecdote and work my way over. But I first want to just thank David for his description of Texas 2036, because basically that's what the Meadows Mental Health Policy Institute is, but only for mental health. And we were kind of the prototype that our common friend Tom Luce did to see if there was this way to look at the intersection between policy and practice and help Texas move forward dramatically. And we did similar movement. I mean, you talk about the uninsured, David. Those were the statistics we were looking at around mental health care back when we started in 2013. So we have that kind of common pedigree, and that's what we focus on, is we focus on mental health. But you know, today I'm really here to focus on brain health, because we need to talk about mental health within the context of the brain and also within the context of the body that houses the brain. And because of that, and this may be hard for some of my friends here who work with us on our national level or who work with us on an international level, but I'm going to really lean into my Texas roots today. So I'm a got here just as fast as you could, Texan. I wasn't born here, but if you're a useful person, Texas welcomes you, and we would like all of you one day to move to Texas and to help us. And I was a person who did that because of Tom Luce. And when I got here and we were starting out the Institute, Tom said, I need you to come down to Houston to meet with Maureen Hackett. And Tom actually made a little bit of a mistake on that, because he thought I was originally going to meet with Jim Hackett, who's a trustee here, but he was totally wrong. And Jim realized this quickly and told Tom, said, no, you need to meet with Maureen. And Maureen really was the driving force that helped us from the beginning of the Institute, but helped us establish the Hackett Center that we have here in Houston, which really focuses on making sure when we go to Austin or when we go to Washington, D.C., or when we meet with our colleagues in Europe to think about things in Brussels or think about things in world events, that we have the amazing knowledge and expertise of institutions like this driving that. And so that intersection between the local work going on here in Houston is really important. And so without Maureen, we wouldn't have that. But the other thing Maureen does, and why I want to lean into my, not just my Texas roots, but my Houston roots. So I'm actually acting like a Houstonian today. And you gave one of my sons 2 degrees. I only have one son. You gave my son 2 degrees. So I kind of feel like the amount of money we paid to Rice University gives me an opportunity to do that. I also want to lean into the Hackett Center piece when Maureen takes us nationally, because literally every one of our partnerships, whether it's with Mass Brigham General, whether it's with the National Alliance for Mental Illness in DC, whether it's the American Heart Association, all came out of relationships that Maureen had developed over decades of advocacy. And that's, I think, the thing I want us to think about today, is this is a really difficult time for policy, right? we're in a different world than we were in October of 2024. And a lot of the assumptions that many people had about how research was going to fund, about what the overhead rates we could charge, the indirects, all of that has been stood on its head, and it's complicated right now. And so I'm going to talk a lot today about how relationships and building partnerships with unlikely places like all over Texas and other places, and building partnerships with folks across the political aisle is going to be critical to us getting things done in the next 4 years. So I'm going to leave it there, and we'll come back and talk about the implications of that.
Absolutely. And speaking of Texas roots, we'll go to Joel because he's wearing boots and he was born in Texas, representing. Joel, any thoughts from your perspective?
Sure. So thanks for having me today. And like Nathan's mentioning, I work at Rice University in government relations, particularly focused on the state legislature in Austin. And as far as the timing of things go, very specifically with the year 2025 and the month of May, as you'll notice, I'm replacing Dr. Lalani, who is currently at the state legislature right now. They're kind of in their final days of the legislative session here in Austin, only about 10 or 11 more days left. So we are in the current state of making policy and deliberating over policy in the state legislature. So as far as timing goes, the next time the legislature will do that in Texas won't be till 2027. So trying to take advantage of the current economic state of Texas, which is very positive right now. We've been working with the budget surplus in the state, so the policymakers have been able to really work with a lot of funds to invest into different strategies, including brain health. So this has really been a really great opportunity in Texas to take advantage of these things and get alignment with different groups like we have up here as well, and different universities across the state. But specifically to the timing, that is why Texas is in such a good position at the moment.
Yeah. Any personal anecdotes? You don't have to. But.
I actually used to come from the legislature, and it's so funny hearing all the panels just talk about all of the little things that we can be doing on a personal level or as a company to get the best outcomes, for workers and put them in the best environment. Like I was mentioning, the legislature meets every other year, and they meet for 140 days at a time, so it can get very intense, and all of the good things that we're talking about are not necessarily the way the legislature functions. It is very crammed and it is very intense, especially these last few months. But as a former staffer and hearing all of these good practices to promote good brain health, it really is something I take back and talk to friends that are still in the legislature to try to implement these in their day-to-day activities and the practices that they utilize at the Capitol. So that really, it does, there's a long way to go, but I do think that these practices do have an impact, especially with our folks back in Austin trying to get the best outcomes.
Yeah, absolutely. Russ, how about yourself?
So I think we haven't talked about the most amazing change happening right here in Texas that a lot of people in this room are responsible for. I live every day in an environment of trying to protect federal investment in biomedical research, which, to your point, we've taken for granted for a very long time. And I can't tell you how heartening it was to hear that the state of Texas, home of MD Anderson Cancer Center, by the way, the most amazing cancer center in the world, has decided to make that kind of a commitment through DPRIT. And I think at a time when everything in Washington feels like it's spinning it off its axis, to see this kind of progress here in Texas, and I think Joel and many of you in this room have a lot to do with that happening. And we shouldn't keep going without acknowledging that that's just an incredible accomplishment at this time, even with the budget surplus, to decide that this is the time to invest in DPRIT in Texas right now. I think it's a counter-cyclical thing that's going to help, at least in Texas, with some really possible negative effects of what's going on in Washington. So I just want to say, what you all did is like giving hope to a lot of us outside of Texas as well. Jealous maybe, but giving us hope. So I don't know if it's time to call for a round of applause, but I kind of feel like it is for everybody who worked to get DPRIT real.
Absolutely. Well, thanks for that, Russ. And actually, you're kind of teeing up the second question, because when we talk about going beyond the why and the timeliness in this moment in time, we're thinking about the what and how. And you touched upon both of those at the federal and state levels. I obviously could pontificate quite a bit about the federal level and to your point about spinning on axes in various directions, but talking about DPRIT, talking about the state level, Joelle, when we get into the what and how, not too much of what we talk about has to be prescriptive and in deep detail, but as we think about a policy agenda, this is a big thing. And the accomplishment of DPRIT, knock on wood, right there at the doorstep, and then on to November. But could you kind of talk to us a bit about what has been done in Austin? What is DPRIT? Kind of how we got to that point, and then maybe we can talk with some of our other panelists about other things that policymakers can be doing to advance brain health.
Yeah, so I know it's been mentioned over the past couple days, but Texas does have a cancer prevention research institute, and so the DPRIT Institute has been modeled off of the CPRIT program, and so the CPRIT program has been in place for over 15 years now, and it's been very successful with MD Anderson and others being able to invest in cancer. The legislature has seen that model and now try to duplicate that with the DPRIT program. And so with the budget surplus that we have, the legislature has committed $3 billion over a 10-year period of time. So later in November, and I know part of what we want to talk about is the public awareness for this initiative and making sure we can generate enough support from the general public for something like this. But the $3 billion commitment is directly from the budget this year, where traditionally in the past, like CPRIT, they actually had to bond money from the state to do that over that time. So this is just straight money from right now, $3 billion to this program. And so the voter referendum in November will actually help have this as a constitutional dedicated fund moving forward. So the legislature won't have to deliberate over this in future sessions. That will be constitutionally required for them to commit funds to this into the future, which is fantastic for sustainability and a positive trajectory there. But I do think with other universities and coming together and advocate for something like this, I know we have representatives from Dallas here, we have representatives from other universities in Houston, but like we were mentioning with Jacob on the last panel with the Rice Neuroengineering Initiative, UTMB Galveston and UT Dallas setting up brain and neural research centers. There is a commitment from academia as well to this type of research. And so Rice, a little bit different being a private institution versus our state-sponsored institutions like the University of Texas, but trying to collaborate and meet our policymakers where they are. I do think back to the timing aspect of this, we've had Governor Abbott be the governor of Texas for 10 years now, one of the longest serving governors of the state of Texas. And so he has had his leadership well established, and we've had the same lieutenant governor over that duration of time. Several different speakers, but you have leadership that is aligned in a lot of different aspects, including brain health, which has been a very opportune moment for something like DPRIT to come out of that alignment of leadership. So it has been something that, as far as what we can move forward with, there will be changes, in the foreseeable future, whether it's members running for Congress or other federal aspects that leadership will be looking at. We hope to sustain the momentum behind something like a DPRIT initiative moving forward. Unlike DC, the state has been very stable in that sense, even if it is going to be a different lieutenant governor or a different governor in the future. We hope that the momentum and commitment to something like DPRIT will be sustained moving forward. But the other things I did just want to mention, other policies, where we can contribute. I know the past panels talked about cell phone usage or AI technology, where brain research can help meet these policymakers on what they think is important. You're having policymakers currently deliberate over policies to prohibit cell phones in public schools up to a certain age. And so we want to be able, whatever issues the legislature is deliberating or making the important issue of the moment, where brain research can help and provide some context on this. And so it's really important not just to be in silos as an institution or any other institution, but to meet the legislatures where they are and kind of what they're focusing on as well, and how brain research can contribute to that.
Yeah. David or Andy, feel free.
I might add two observations on DPRIT. The first based in part on our experience at Rice with CPRIT. So when you sort of put dementia in front of it, you think, okay, this is going to be a narrowly focused thing, and it's going to affect mostly older folks. But so much support for basic research emerged out of that, and people with immense capability from basic to applied, that what we're going to see out of that, I think, is two really important things. We're going to learn things and advance science and understanding that are going to affect all aspects of mental health and brain function, and that's going to just advance science broadly. That's just the way science works, right? If you don't produce knowledge, and when Kennedy spoke at Rice Stadium about going to the moon, even then he realized this was an effort that was going to produce knowledge of benefit that we couldn't even begin to imagine, and this will be like that. The other real benefit out of here is, following CPRIT at least, it helps knit institutions together, right? Put joint projects together. We have an incredible base to build on here in Houston, UT Health, others. I couldn't even begin to list all of the institutions just in Houston, but also you go all across the state as well. But we need to work a little bit more together, and I think DPRIT is going to actually help us do that more effectively. With all that, and I'm an incredible enthusiast and I'm very appreciative of the Lieutenant Governor, I think we also need to keep our eye on the ball for other aspects of mental health. Addressing issues of dementia will be great, but if you compare the impact of addressing dementia with addressing the issues that affect children and young adults, that economic impact, lifelong impact on those children and young adults far exceeds the impact of addressing the dementia issues. And again, I want to be very, very clear here. The dementia issues themselves are huge, but I hope we won't lose sight of the importance of addressing the issues that affect humans earlier in their lifespans.
So I mean, the last part, David, you're saying, it's so tempting to talk about that now, so hopefully we come back to it, because the key word, other than dementia, is prevention. And I want to come back, and I think it's really important that when we do come back to prevention, we talk concretely about it, because it's a wonderful aspiration, but if we don't figure out how to translate it into the lives of real people here in Texas and elsewhere, we're not going to deliver. Talking policy, though, to step back before we kind of go off on there, because that's really where I want to talk, because I mean, our mission at the Hackett Center is really to translate policy into practice, and that's the bottom line. But at the policy level, I think there's just two things I would emphasize. One is, again, an anecdote with Maureen. The first thing Maureen did for us when she got on our board was she organized a dinner here at the Texas Medical Center with the leadership from both medical schools, and they said, hey, this guy here, Andy, is here to try to improve mental health services in Texas. What can he do to improve the delivery of services? And one of the two heads of one of the two medical schools, I won't tell you which one, but you can probably imagine, because he was pretty blunt, said, just do a CPRIT for the brain. Then we're done. That's all we need to do is a CPRIT for the brain, and we're done, because he knew that if we could put the institutional commitment of research, infrastructure, partnerships with industry, all of that we did back in the 60s with the Moonshot program, and that we did over the last 2 decades with CPRIT, that we could build institutions. And right now we actually have 3 national centers for cancer treatment in Texas, as opposed to just one. MD Anderson's obviously our flagship, but we have multiple places where Texans can reach that, and multiple places where they can come in. So I think just so keeping in mind that practice aspect as you talk to policymakers, because as Joel said, that's what policymakers care about. I mean, they want research, but they want their constituents to get better. And then the second one is, remember that this is about not just academic partnerships, but it's about partnerships with industry, and that non-diluted capital that was being talked about in the last panel, this is a source. And it's a source if you can bring capital to the table. And those are there's 2 risks that you are going to have to do if you're going to be able to play ball with DPRIT. One is you're going to have to bring some capital to the table, because we're not just going to give you money, we're going to want to partner with money. The other risk is we're going to try to talk you to move into Texas. So just be ready for that. But those are your 2 risks.
Very risky, obviously. Anytime you talk to a Texan, they always try to get you to...
Especially if we give you money.
Yeah. I mean, that's why the state's growing so fast. We're investing.
One of.
Russ, any thoughts on what policymakers can do, maybe DPRIT or beyond?
So I think also important to say, yes, it's important to do mental health, and research into the brain is going to be revelatory no matter what. Reflecting on a dinner I had with some researchers in DC a while back, and one of them was a neuropsychiatrist. And I asked him how he got into the field. And he said, well, I was the top of my class at Washington University School of Medicine, so no slouch of the School of Medicine. And it was just assumed, because I was the top of my class, that I was going to go into surgery. And I decided to go into neuropsychiatry because the brain is the most complex organ that we know very little about, and I think it's a whole lot harder, and I wanted to challenge myself. And I think that's, it is, to your point, going to give us so much insight. And I think where policy can help is to not get in the way of that, frankly. Sometimes what policy can do is provide the start and then make sure that as we go, we're not constraining the creativity.
Well, that's actually a great segue to my third question, which is about why not, right? Like things can get in the way. These can be things that keep policy from happening. I mean, DPRIT did not happen overnight. This was the 4th session in a row where a concept like this was brought forward. So 8 years of working away on that issue. So there's some reasons why things like that do or don't happen, moments in time. But Andy, maybe I could turn to you on this question about why not. Russ just pointed to something that's an example of that, but I'm sure you have your own. You guys have worked on a lot of policy. What do you think about like the why not? What are things that can get in the way when we think about what policymakers can do and then what may prevent them?
Yeah. Well, I think the big one, which I think it's maybe provocative to talk about, but like there's a hard time politically, and there have been a lot of losses, and like Russ was saying, I mean, there are going to be real implications from what's going on in Washington D.C. And as David said, they're nonpartisan in their approach. We're nonpartisan in our approach. I think though we're going to have to maybe put the relationships in there more, and not in addition to being nonpartisan, we're going to have to be bi or multi-partisan. We're going to have to build relationships with people we did not think we would have to build relationships, and some of us may not even want to build relationships. And let me kind of tell you what that means. If you cannot say with a straight face to a policymaker that part of what you want DPRIT to do in its partnerships federally is to make America healthy again, if you can't get those words out of your mouth without like grimacing a little bit or feeling like you're selling yourself out or somehow you're, conspiring with the devil, then bring someone who won't feel that way, because you're going to have to get past that. We're going to have to work together on these things. And when you step back from whatever we else want to say about the current administration in terms of some of the things that are real challenges in the research world, the idea of beginning with root causes like sleep, diet, exercise, not just for the non-brain part of the body, but for the brain, and to have part of our research on dementia prevention be grounded in what makes the overall body work well in terms of inflammation. We're going to there's opportunities to do that. And while there are challenges, there are also new opportunities. And as things get reshuffled over the next year or two in Washington, D.C., being able to have a base of work like we're talking about here around dementia prevention in Texas, and being able to tie that to a inflammation-focused, body-focused agenda that looks beyond just the brain at the rest of the things we need to do to be healthy, you're going to have to do, and you're going to have to do that with people that you may not have worked across the aisle with before and never wanted to actually work with. And then you're going to need to do that.
Yeah. Yep. Dave?
No, I wasn't going to add anything on that, but what I wouldn't lose sight of, I briefly mentioned, is the importance of access. We can do a lot of research and understanding, but if we don't address the access issues, and particularly here in Texas, and it's from a whole bunch of sources, right? It's from, as I said before, the high number of uninsured, but it's also from the very low number of mental health professionals that exist in Texas. There was a thing I couldn't remember, 246 of Texas's 254 counties are designated as mental health professional shortage areas. We're ranked about last in terms of that accessibility. And there are a lot of things that we can do, including reciprocal licensing, which in the mental health area is extremely limited, I would say. Making sure we have mental health access and professionals in our schools to deal with very complicated issues that folks are dealing with, and we may give them bad grades, but are we really helping them address the issues that they confront. So I think these, maybe a last thing I will mention is making sure that, not just in terms of the top tier of professionals, the psychiatrists, but we need other mechanisms to deliver mental health care. And those include professionals who are trained at lower levels to assist those folks and provide help. And our community colleges, for example, can play a great role in that, as they've done in the mental health professions more broadly. And telehealth is another example that can play a role in mental health. And we're not there, but Texas, really the bad news is we're not in a great position for mental health access in Texas. The great news is we actually could be positioned very rapidly to improve where we stand in every aspect of mental health, whether it's research or treatment or access, but we do have to address those issues very specifically, or we'll end up being the source of great knowledge that other states use.
And if I could just add on that, I think it's a glass half full, glass half empty thing. Because David's right, we have these areas, which by the way, the rest of the country does too, right? I mean, there's a huge workforce issue. And yesterday we talked about, what are the challenges in being able to do research by just being able to give patients access? We can't do research if we don't have patients being able to get through our institutions. So this has direct implications for research. The two things that we've stood up in Texas over the last 5 years that have been directly around policy have been a statewide telepsychiatry network with all 12 of our medical schools that reaches currently 4.3 million of our 5.5 million school students. So we doing things like that, and then just like David said, we made a huge investment in community colleges. So building that non-licensed professional workforce, while yes, that's the hope, we actually have the resources in place. We just need to act on it. And I think that's really what needs to happen here in Houston and across Texas, is build the partnerships to act on that now.
We talk about access, and you've been talking about access in terms of mental health, but it's beyond mental health. It's everything, right? And so I go to these conferences all the time, and mostly they're researchers, and they're talking about cool innovation. I mean, we heard some great, Steve's panel yesterday, all kinds of great innovations yesterday. There's all kinds of stuff coming out. And when we talk to voters about investment in research, investment in biomedical research, medical research, whatever, there's sort of vague support, but they also kind of conflate healthcare and health outcomes with medical research. If our medical research is so great, why are we so sick? If our medical research is so great, why are we all, why did lifespan take a tank? Why aren't we healthier? And a lot of that comes back to access. It's not just mental health, it's everything. So one challenge for folks in the room, and I know this is, a thorny issue, but if we don't solve health care in some way, if we don't make health care better, it's going to cause a decrease in at least federal support for, and probably ultimately state support for innovation, for de-risking these great technologies that we've been hearing about. If we don't show better outcomes on health, this enterprise is sort of, I think, living on borrowed time.
It's a great example of a why not. Joel, let's get your perspective on this too, because you literally interact with the legislature on a daily basis. You could probably speak pretty robustly about why not. What are some of the impediments to progress?
And so this legislative session, like I'd mentioned, CPRIT's been awarding grants for a little over 15 years now, but they were brought in, CPRIT leadership, to the legislature at the beginning of the year, and they were asked that same question. What are the outcomes? We've invested X amount of dollars into cancer research, but we haven't really seen health outcomes improve. And so they were asked that, and these things take time, frankly, is kind of the first response. But I think setting expectations and trying to understand, okay, the underserved communities in Texas, because there's quite a divide between Highway 35, if you're familiar with the state, Dallas and Austin and San Antonio down 35, and Houston, all the metropolitan areas just east of that. But then West Texas is traditionally underserved in a lot of different ways to healthcare access. So CPRIT has made it a priority to focus on getting more of their services and prevention strategies out to West Texas and the underserved communities. So I know Deep Rit and whatever leadership will be put in place for Deep Rit, that will be a big emphasis for them as well, to be able to come back to the legislature and demonstrate the impact that they're having for these communities and these areas of Texas that traditionally just haven't been able to access this type of health care. But there are political headwinds just to be aware of as well, besides other things as far as the sometimes negative narrative around academia. There's been a big emphasis from legislative leaders on research security in Texas. And so, well, even across the country, but I know at Rice we've made investments into research security and bringing on folks that have worked previously at the FBI and others to understand just what we're doing at Rice is secure, and the research that we're putting out is going to be in safe hands as well. So there are political headwinds from other aspects and policy considerations that we need to be aware of, but just moving forward with an initiative like Deep Rit now, just making sure that the prevention aspect and access is going to be important, especially to these other areas of the state traditionally that just haven't been able to access it.
Well, we're getting the sign. So with that, ladies and gentlemen, please join me in thanking our panelists for their time and their contributions today.